Hi, my name is Nancy Hodgson. I'm an assistant professor here in the School of Nursing at Johns Hopkins and associate director of implementation science for the Hopkins Center for Innovative Care and Aging. So my research is focused on biobehavioral intervention research, so developing interventions to support people living with chronic conditions, in particular people living with dementia. Once we reach the age of 80, we typically have at least one chronic condition that we're living with. Most of our healthcare system, unfortunately, is still fragmented, and so many of the unmet needs for those individuals over age 85 living with a chronic condition fall to family caregivers. One chronic condition I'm particularly interested in is Alzheimer's disease. It affects about 5.2 million Americans right now. But most of the care for those individuals living with dementia is taken care of by family caregivers, about 15 million family caregivers who are unpaid or providing most of that fragmented care. And so our work has been looking at designing interventions to support family caregivers and people living with these chronic conditions. Most of that work has been biobehavioral in nature in terms of understanding the mechanism of why these interventions are effective so that we can tailor it to the family and to the person living with that disease. This is important for nursing research because nurses fill an important role. One, in assessing for symptoms and identifying the symptoms that people live with these chronic conditions, and in coming up with a strategy for helping that person diminish the symptoms or cope with those symptoms. We also fill an important role in terms of educating family caregivers. And so I see this research as having an important role for future nurses and for future nursing practice. The research funding I've received, the federal research funding I received from NIH, has been pivotal in designing these interventions. And right now we have a sufficient evidence base. We have a lot of important work that we've done, thanks to federal funding, to support family caregivers. Our next challenge now is in moving that intervention work forward in terms of getting it into practice settings. And it's an area called translational research or implementation research that is in pivotal need of, is at a pivotal time in terms of needing funding. We need to get this information to families and to people living with chronic conditions who are really desperate for this information. So the challenge facing many nurse researchers is that a lot of the research funding available, even though it's a smaller and smaller amount of funding available, is focused on finding the cure. That's certainly been the case for Alzheimer's disease research. And yet what's missing is research funding supporting those individuals who are living with those conditions. And NINR, the National Institutes of Nursing Research, is focused on symptom science, focused on palliative care or helping people who are living with conditions maximize their dignity and quality of life, and in educating family caregivers. And so that is an important area of research that needs continued funding because it's receiving smaller and smaller piece of that very little funding pie.
Hi, I'm Dr. Finnell. I'm an associate professor at Johns Hopkins School of Nursing, and I am here today to talk about some of the research that I've been doing over the last decade and more. My area of research focuses on people with mental disorders and substance use disorders. Most recently, I've been focusing on preventing the progression of substance use to substance use disorders. And this is really an important area because in 2013, a survey showed that more than half of Americans aged 12 and older reported current alcohol use. What we know is that scientific knowledge that alcohol and other drugs affect the brain, and that substance use disorders are identified as brain-based disorders. But this has not been widely integrated into curricula either for nursing or other healthcare disciplines. It also hasn't been disseminated to the public, to healthcare providers, and it's not widely integrated into substance use treatment programs. So my area of research focuses on advancing the knowledge and the competencies of nursing faculty and students in the schools of nursing here at Johns Hopkins, but also around the nation, and also to advance that knowledge in nurses and healthcare providers who are currently in practice. I have received funding from the Substance Abuse and Mental Health Service Administration, and this has been really important funding to receive because without this funding support, it's difficult to add more content to the curricula or to have that time to develop materials to integrate into curricula. And so SAMHSA has been very generous with these grants in trying to increase and really push this agenda across the nation. And we hope that that funding continues.
I'm Jennifer Wenzel. I'm an associate professor at Johns Hopkins with appointments in the School of Nursing and the School of Medicine, in oncology, also in cancer prevention and control for the Sidney Kimmel Comprehensive Cancer Center. My research is really centered on helping patients and families navigate anything from cancer diagnosis through survivorship. We actually begin with interventions related to cancer screening, how patients can get to screening. So fairly early in my career, I received grants from the American Cancer Society and the Robert Wood Johnson Foundation, and these grants were tremendously helpful in putting together an intervention to, again, provide people who are affected by cancer disparities, so particularly rural seniors and their care partners, and provide support to them using a community health worker approach during cancer diagnosis and treatment. We are looking at expanding those approaches and searching for funding to do that. And our interventions have really been led by patients and families in terms of what they've told us is really missing from the current healthcare system. We find this is particularly true for care partners who may be the most overburdened and taxed when it comes to the cancer experience. One of the things that we can do through funding studies with community health workers is to really look at, and some of the things that we are doing and seeking funding for, is how, as we have increasing healthcare shortages, can we maximize and meet patients' needs in a better way using teams of healthcare professionals and lay healthcare workers, and what are some tools that we can develop to help them in that work, because we don't have a lot of tools for community health workers or for patient navigators. These are fairly new roles, and I think as we create new roles, that's very exciting, and I think the opportunities and the potential is there, but we really need to look at how do we support the people who are providing these services, and what kinds of tools are we giving them that are really going to help systematize that work and make it something that people can use everywhere.
I'm Nancy Glass. I'm a professor here at the Johns Hopkins University School of Nursing and the Associate Dean for Research. My research focus is on ending violence against women globally. And 1 in 3 women will be abused physically or sexually in their lifetime. And most often it's by an intimate partner or someone she knows very well. This is also a significant issue in our global context now, with the focus on refugees and immigration, where many women are fleeing conflict, where they're subjected to forced sex and other forms of violence. So the reason why as a nurse I focus on gender-based violence is all the significant health consequences that are associated with experiencing violence. For example, women who are abused or experience violence are more likely to be depressed. They're more likely to be at risk for HIV and other sexually transmitted infections. They're more likely to live in poverty and more likely to experience other forms of violence in their lives. Why continued funding is extremely important is that as we are in a context of ongoing violence for many in our global community, having programs that prevent violence from ever happening, but also having effective programs that respond to survivors so that they can continue on with their life, being productive, being good parents, is incredibly important.